recording. Okay. Welcome everybody to our webinar, Residential Placements Overview for Children and Youth in Foster Care. This webinar is focusing on some ways that youth will access residential placement through foster care placements. We do acknowledge that youth are also able to access residential services, treatment services through their insurance, but this particular webinar is going to be focused on children that are accessing those services through foster care placements. For this webinar, the chat is disabled. We are recording. For questions, please utilize the Q&A function. We have staff that are working in the background to help answer your questions, and we will also reserve some time at the end to verbally respond to some questions as we are able to. The webinar recording and slide deck are going to be posted on our website in the next couple weeks after we are done here today. So, and that website is the same place that you registered for this webinar today. Next slide, please. So today we are doing this presentation in conjunction with the Department of Human Services, specifically with the Behavioral Health Administration. My name is Ashley Soldier-Beckman. I am the Child Foster Care Wellbeing Program Representative in the Department of Children, Youth, and Families, Child Safety, and Permanency. I will pass it to Liz.
Hi all, I'm Liz Bosnick. I also work at the Department of Children, Youth, and Families in our Child and Safety Administration. That's not correct, but anyways, I have two roles. I work on our QRTP team, and then I work with Ashley around children and youth with complex needs.
Katie.
Hello, everyone. My name is Katie Luer. I'm a unit supervisor in the licensing division, and we license children's residential facilities, amongst other types of programs.
Rachel.
Hi, everybody. I'm Rachel Carey. I'm with the Behavioral Health Administration. I am the Children's Residential Services Policy Specialist. I partner with Angela to provide supports to the facilities.
Angela.
Hi, I'm Angela Agboku, and I am the Children's Residential Treatment Clinical and Policy Lead. Work with Rachel on collaborating and helping to provide support to the residential facilities.
Thank you. And we also have with us Alicia Wolfman, and she is going to be helping us with all of our questions. She works with us in the Department of Children, Youth, and Families. We want to extend a lot of thanks to Department of Human Services, Licensing, and Behavioral Health Administration in working with us today to provide you this information. Next slide, please. Our goal today is to provide information to you about different types of residential settings, including the specific purpose and scope of those settings and those services. We want to review child welfare requirements when placing a child or youth in a residential setting. What are some of the implications of putting a child in out-of-home placement for treatment purposes? And we are also going to provide you today with some demonstrations on how to use licensing information lookup when you are, so that you can use that information to be able to find the appropriate services and settings when you are looking for a residential placement for a child. Next slide, please. So here is a brief overview of our agenda. First, we are going to be reviewing what is public child welfare. We want to really center this conversation on public child welfare, foster care. What does it mean to provide welfare for a child? We're going to go over juvenile treatment screening team, which is a specific child welfare requirement when placing a child in a residential facility. Then we're going to go over the different types of residential settings, and then we will pass it over to our colleagues in behavioral health and licensing to review the specific services that are available in those settings. We'll also be going over some SSIS data entry best practices, and sprinkled throughout, we'll do a couple of demonstrations of licensing lookup. Next slide, please. Okay. Through all of the work that this team has done in providing technical assistance to counties and tribes around service access for children who have complex needs, one of the things that often makes case planning very challenging is the fact that a child's service needs crosses the breadth of service categories. So this will involve multiple case managers from a variety of disciplines, and each of these case managers has their own policy requirements. As our presentation today focuses on services that are available in residential settings, we first wanted to center our conversation around a common understanding of what is public child welfare and what is that system. So we have a link here, Minnesota statute section 393.07, and this will be clickable for you once we have posted this presentation for you. And it defines what does Minnesota consider to be the public child welfare system. So next slide, please. Here is a nice visual for you on what the intention of the public child welfare program is. As you can see, the statutory intention of the public child welfare program is to protect and assist children who have social, physical, or emotional challenges. The statute specifically calls out protection, and it includes protection not only from neglect and abuse, which is typically handled through our child protection system, but also protection and assistance for mental, emotional, and physical disabilities, as well as providing for the needs of parents who need help with their children. So as you can see, it's really a holistic idea. When we're looking at the public child welfare program, it's this holistic idea of the whole family, all of the needs that the child or the family may have. Next slide, please. So here's another visual for you guys as we are going through our information today. CW means child welfare, and that's what we're grouping in for case management as child protection, adoption guardianship, any other type of child welfare type of case management. Waiver would include CADDY, DD, brain injury, CAC, any other type of waiver program that a child might access. And then CMH stands for Children's Mental Health. So these are all different areas that are called out really within the public child welfare program. Physical disabilities, mental health disabilities, child protection related issues. And this is how we divide them out in the lead agencies. Each case manager is a highly specialized and highly trained professional within their scope of services. When we are looking at needing to place a child into a residential facility, it is very important that when you are coming together as a team, that you are looking at what are each of the specific areas that your service can focus on and provide in making a decision on what type of services you need to offer for the child. Next slide, please. One of the methods of protection and assistance within the public child welfare program is to provide for family-centered interventions. When a child has very complex case needs, multiple case management services are involved. And so documenting reasonable and active efforts to prevent placement is essential. Child welfare speak, that's child welfare speak, reasonable and active efforts to prevent placement. But this is really what we're talking about when we're talking about reasonable and active efforts is what are all of these services and what are all of these family engagement and support activities that you are doing prior to actually looking at a residential placement for a child. If ICWA or MIFPA apply for a child, then that means that that tribal engagement is required and it's essential. And eventually, if a child does require residential placement or any type of out-of-home foster care placement, then these steps that you took prior to placing the child in residential is all going to be reported to the court. So again, this is why it's very important for everybody to come together, bring their specializations to the table, and lean on each other to identify what are some services and supports that you can access prior to putting that child into residential placement. Okay, next slide, please. So as we said before, we do acknowledge that children can get into residential placement through other means other than foster care. This presentation is focused on foster care placements and what are those requirements around foster care placements. So first of all, what is foster care? Foster care is a temporary court-monitored service to promote safety, permanency, and well-being of children and youth. And then we have in our next slide the actual Minnesota statutory definition of what foster care is. So there are a couple of things that I want to highlight in this definition. First is that it is 24-hour substitute care for a child for whom a social service agency has placement and care responsibility. So keep that phrase, placement and care responsibility, in mind. We're going to talk about that more in just a moment. Now, next, look at the very last part of the sentence on here. A child is in foster care regardless of whether a facility is licensed, and payments are made for the cost of care. What this is referring to specifically is foster care maintenance payments. So there are certain types of residential placements, such as certain waiver covered services, that foster care maintenance payments might not apply. That does not mean that it is not foster care. Foster care is 24-hour substitute care for a child for whom a responsible social services agency has placement and care responsibility, regardless of if we are paying for it. Next slide, please. Now, this last part here is really getting at the intention of foster care. It is intended to provide for a child's safety or access to access treatment. It cannot be used as a punishment or consequence for a child's behavior. Okay, next slide, please. So back to that definition, I asked you to keep in mind legal responsibility for the care and control of the child while the child is in foster care. This is what we commonly call placement authority. Now, placement authority, this is a core component of foster care. It gives the county or tribe the legal authority to make placement decisions for the child and for the family. So we will go on to the next slide here. These are the different types of placement authority. Court order, CHIPS. This is commonly what people would be understanding as through the child protection system. A CHIPS petition, a child in need of protection or services. Then there are two main types of voluntary placements, one under 260C and one under 260D. And then if the child is Native American, if ICWA or MIFPA apply, then there are additional requirements, specific requirements for voluntary placement for those children. We do have a webinar that we put out earlier this summer that goes into specific details about voluntary placements for treatment under 260D. And it is now posted onto our website. The recording is posted on our website. So please, I would encourage you to check that out. If you are working with children who are under a voluntary placement for 260D, we go through the requirements, the foster care requirements, the court reporting requirements in detail about that type of placement authority. Next slide, please. Okay, so we're talking about residential treatment, correct? That's what this presentation is supposed to be about. Residential services, residential treatment. When a child is going to be placed in residential treatment, it is required that the county assemble a juvenile treatment screening team, and the juvenile treatment screening team must approve for the residential treatment to occur, the placement for residential treatment to occur. So a juvenile treatment screening team is outlined in Minnesota statute section 260C.157 subdivision 3. Some counties call this their screening team. Some counties call it their residential team. I've even heard it referred to as the Rule 5 team, which is that's a pretty antiquated term, but some counties do use that term as well. The juvenile treatment screening team consists of agency staff, social workers, people with expertise in treatment for children. It also includes the child's parent or guardian, the child's relatives, child's foster care provider, and others who are a resource to the family, such as teachers, medical or mental health providers. So you could call it a multidisciplinary team that is assessing the child's needs and assessing to see if they are actually in need of residential treatment. It is really important to understand that the juvenile treatment screening team is required whether you are looking to place the child into a residential facility, children's residential facility for treatment purposes, or if you are looking to place them into a foster residence setting, such as a waiver-supported group home. There are very few exceptions for when a placement may be made in a residential setting without the use of a juvenile treatment screening team first. Those exceptions are outlined in the statute that we have provided here, but they are very, very few. So generally, it is absolutely required that you need to do a juvenile treatment screening team, and they need to approve of the residential treatment. Next slide, please. Okay, so how the juvenile treatment screening team evaluates is they utilize the assessments that are conducted. So if the child has open children's mental health case management, they are likely going to be using that diagnostic assessment. If they have an identified substance use disorder, they might be using that assessment. Or if again, we're looking at waiver supported group homes or waiver supported treatment, then they would be looking at the MnChoices assessment or the other sorts of long-term care assessments. The juvenile treatment screening team is going to be considering lesser restrictive options first. So this goes back to what we were talking about before with those preventative services, the family-focused interventions, the whole idea behind the public child welfare program in looking at how can we prevent placement in the first place. So this would be a portion of the case review where you would be identifying, here are all of the things that we've tried, and here is why we believe that treatment is required at this point. So they will be looking at considering less restrictive options first, like I said, is if a foster care placement can be prevented by the child living with a parent, with community-based services offered, consider what types of children's mental health services could be available. What types of waiver supported services could be available? Are there other types of community services that could be available to help support that child? Is a foster care placement necessary, or can the child be placed with a relative or with a kinship provider first with those community-based supports? And then lastly, is the more restrictive setting or the residential setting required? Is it necessary in order to access treatment? Okay. I am now going to pass this over to Liz, and we are going to be getting into the meat of the rest of our presentation.
Thanks, Ashley. Hi again, everyone. I'm Liz. All right, we're going to start diving into the types of residential settings, as well as aligning case planning and the child welfare requirements that Ashley covered. So in Minnesota, there are two types of licensed residential settings for children. The first is children's residential facilities, also known as CRFs, and then child foster residence settings, known as CFRSs. Nothing like having those two acronyms so close together. A residential setting in Minnesota is defined as a setting where children are cared for in a shift staff model. So there's staff that are coming in to the program to care for children. Just to kind of level set us a little bit, this webinar is not going to cover settings that are licensed by the Minnesota Department of Corrections, child foster care settings, because these are not considered residential, they're considered family settings. And we're also not going to be covering crisis respite waivered services provided in a hotel setting. All right, so jumping into children's residential facilities, or CRFs. At a high level, these settings are required to meet standards set by Minnesota Rules Chapter 2960, which is the licensure and certification of programs for children. CRFs are licensed by the Department of Human Services or the Department of Corrections. And the CRF services or certifications identify specifically what that CRF offers. And later on in this webinar, we're going to talk very specifically about the services that CRFs can offer. Typically, CRFs have a mental health focus as they provide 24-hour care, supervision, food, lodging, training, education, treatment, all of the above for the child when the child is away from their home or family. Then moving into child foster residence settings, or CFRSs. So CFRSs are also required to meet the standards set in Minnesota Rules 2960. You're going to see on this slide that we also talk about waiver services, because these services can be utilized in a CFRS setting. However, they cannot be utilized in a CRF. So waiver services can be utilized in a child foster residence setting, but not in a children's residential facility. The majority of waiver services can be provided in a child's home, and in those cases, that's not a foster care placement. But if a child is placed in a child foster residence setting, this is a foster care placement, and it's considered institutional care from a child welfare perspective. So best practice, as Ashley had also mentioned, is attempting waiver services in a child's home before placing in a foster care placement and utilizing those same waivered services. Additionally, a child foster residence provider may also have a home and community-based services license, and in those cases, the provider must also meet the standards set in Chapter 245D, which is the home and community-based services standards. And then lastly, typically child foster residence settings have a disability focus, again, because they can utilize those waivered services. Now I'm going to talk a little bit about the Family First Prevention Services Act, also known as FFPSA, and its creation of the specialized residential settings. So in Minnesota, children's residential facilities or child foster residence settings can be certified to provide one or more of the FFPSA specialized settings. And those include qualified residential treatment programs, programs for children and youth who have been or are at risk of sex trafficking or commercial sexual exploitation, programs for pregnancy or parenting youth, and then supervised independent living settings for youth in extended foster care. I also want to make a note that in September, the DCYF, QRTP, and SSIS teams provided a comprehensive and recorded QRTP webinar. And you can access that webinar recording and the slide deck from the same place that you registered for this webinar, which is on PartnerLink. And again, that's also where this webinar recording and PowerPoint will be available in the coming weeks. Minnesota implemented FFPSA in September of 2021. And so we offer the 4 specialized settings. Currently, we only have providers that are offering TPs, SEY, and PPY. All right, so you're going to get 2 demonstrations here today. Both are going to be how to utilize the Department of Human Services Licensing Division's licensing information lookup website to locate some of these settings that we're talking about today. So I am just going to stop sharing this PowerPoint and switch to my licensing information lookup screen. All right. So like I mentioned, this is the Department of Human Services Licensing Information Lookup website. It's referred to as LIL for short. And you can locate all types of licensed settings, licensed by the Minnesota Department of Human Services or the Minnesota Department of Corrections. So I'm just going to provide a high-level little demonstration on how you can locate children's residential facilities, child foster residence settings, and then those FFPSA specialized settings. And then later on in the webinar, after some of our colleagues have gone through specific services that children's residential facilities can offer, then I'll do another demonstration on how you can look up those specific services. So starting with child foster residence settings, once you've gotten to the licensing information lookup webpage, you're going to go to license type and scroll down until you see the child foster residence setting title. Once you click on that, you will see that it automatically pulls up the additional services, which are the FFPSA specialized settings. So you can choose to click one, and then it will bring up any child foster residence settings that also have a QRTP certification. I'm going to unclick it for this demonstration and hit search. And it is now going to bring up all of Minnesota's licensed child foster residence settings. As you can see over here, it brought up 202 licenses. 181 of them are active and 21 are not active. So an active license is in blue here. And if I scroll down, the kind of orangish red is a non-active license. You can also turn this search into an Excel spreadsheet by clicking on this are available in a CSV file. If I click on that, you can see that it opens an Excel spreadsheet. And then, like I mentioned, all of that same information then is in that Excel spreadsheet. I'm going to go back here and do a new search for the child foster resident setting. I do just want to show you when you click FFPSA specialized setting, when you hit search, oh, I picked the wrong one. So as you can see, this provider is licensed as a child foster resident setting, and then they also provide the SEY certification. If you click into the provider information, you can see more about the provider. You can see their license number, the address, the phone number, what county they're located on. And then additionally, you can find more information about the program. So here's the ages that they're licensed to serve, the number of people they can serve, and then as I mentioned before, there's that specialized setting certification for sex trafficked, commercially sexually exploited, or at risk. All right, going to children's residential facilities, you're going to go back to the license type and scroll down till you see children's residential facilities. And as you can see, this brings up a whole new kind of subcategory of certifications or services that you can click. Here are the FFPSA specialized settings listed here. So if I click search without clicking one of those subcategories, you're going to see that it pulls up 98 licenses with 92 active. So we have 92 licensed children's residential facilities in Minnesota. These could be licensed by the Department of Corrections or by the Minnesota Department of Human Services. If I go back to the children's residential facility and click, say, on a qualified residential treatment program, and then again, click into the actual licensed provider, it's going to bring up very similar information as we saw with the children's residential, or excuse me, the child foster resident settings. You can see the address of where the provider or the facility is located, their phone number, license number, the capacity that they can serve, and then more specific information down here, which includes ages. Sometimes providers have specific genders that they serve. And again, that specialized setting certification is going to be listed here. All right, I'm going to stop sharing that and go back to the PowerPoint here. All right, and as I mentioned, I'll be doing another little demonstration a little later on where we'll talk more about those subcategories that you saw on licensing lookup for the children's residential facilities. So again, I know Ashley covered this slide, but we're kind of just level setting again to remind us that while each case management type has a different scope, the goal is services and supports for the child and family well-being. And each case manager is going to utilize their scope for prevention efforts and when considering foster care and out-of-home placements. And then here are some high-level case planning considerations for residential placements. So with case planning, it should address the specific target behaviors within your case management scope. So again, children's mental health, child welfare waiver, you're going to be addressing those behaviors within that case management type. The out-of-home placement plan, which is a child welfare requirement and must be completed within 30 days of a child being placed into foster care and then updated at minimum every 180 days, or if there's a move or a change in services. So that out-of-home placement plan has to be shared with the provider, so with the facility, so with the children's residential facility or the child foster residence setting, because that out-of-home placement plan not only shares information with the facility or the provider, but there's also space in that out-of-home placement plan to document what are the services and the programs that the child or youth is going to receive while they're in that residential setting. Um, m- uh, Providers and facilities will have treatment plans, and those treatment plans and the case plans must align. They must cover and have similar goals. And again, that's another reason why that out-of-home placement plan needs to be shared with the facility. And then lastly, the out-of-home placement plan, that case plan is the foundation for the agency's reasonable and active efforts to finalize the permanency plan for the child. And those reasonable and active efforts consider discharge and transition planning. So when a child is placed in a children's residential facility or in a child foster residence setting, there needs to be discussion, and the plans need to include, what does discharge look like? What does that transition plan look like? All right. Now I'm going to pass it off to Rachel and Angela, who are going to talk specifically about services that are offered within children's residential facilities.
Perfect. Well, thank you, Liz. Thank you, Ashley, again, for having us partner with you guys today. Once again, my name is Rachel Carey. I'm on the Behavioral Health Administration team as the Children's Residential Services Policy Specialist. I'm going to go ahead and next slide, please. All right, so to kind of dive in on the supports that Angela and myself and our coworkers provide, it's important to reference the whole continuum of children's mental health services in Minnesota. Some of you may be familiar already with this visual, but for those of you who are not, this is our current landscape of services. One thing I do want to point out with this visual is that it currently does not include waiver services. To keep in mind over the next couple years, with the changes occurring under the waiver reimagine, it is the state's intention to work together to identify how waiver and children's mental health cross over. But right now, they are viewed very much as two separate tracks. And while there can and there often is some crossover between the two, this presentation here today is going to primarily focus on the settings that are involved in the mental health track. So from the far left side, you will notice that we have what we consider our least restrictive intervention. And then that is typically what we refer to as outpatient therapy. And then on the far right is our most restrictive. Today, we're going to focus on that green arrow towards the far right, and that is our residential services and treatment. Next slide, please. Perfect, thank you. So to start, like I said, this is a kind of a continuation of the first visual. This just breaks down the residential treatment services that we provide. So on our far left, we have what are called shelters. The intention with shelters is to provide short-term group living environments that meet basic needs, such as a safe place for the child to sleep, food, and hygiene services. These settings are also for children or youth who are in behavioral or situational crisis, potentially at risk of homelessness or homeless. These settings are designed for temporary stays, which is around 90 days. And some of these shelters provide skill building activities, transportation, educational support, and other connections to medical, mental health, and other community services. Next slide, please. Then we move into what is called our transitional living services. So these programs specifically are for youth ages 16 to 21 who need safe, supportive housing while they're preparing for adulthood, or they could be potentially transitioning back into the community. For these individuals, they also may be stepping down from higher levels of care. They could be potentially facing homelessness or aging out of foster care. In these settings, staff assist the youth in identifying and connecting with services such as education, vocational training, employment, mental health, medical care, independent living skills, and transportation supports. One thing to keep in mind with transitional living services is they place a high priority on independence. This is a setting where they really want to do a lot of that skill building because those individuals are entering, if not just entered, their adulthood years. Next slide, please. All right, now we move into what are called our group residential programs or group residential settings. I do want to just touch base here real quick on the name. Sometimes, just kind of based on history here in Minnesota, you might have heard the name for this program used interchangeably. So you might hear the term group home, you might hear group residential setting. That's what you'll see in licensing lookup. They are today focusing on that group residential setting. So what does that look like? So that is, again, a 24/7 supervised living setting for children who need a safe, stable place to stay. These types of settings, they provide structure, support, and guidance from trained staff. They are intended to help children with routines, education needs, social interactions, and once again, a lot of skill building. One thing to note with the group residential settings is we often see youth who are maybe straddling between the Department of Corrections and the child welfare involvement, typically kind of end up in these settings. Now, there is not necessarily a time frame for these settings. It is very much dependent on the youth's needs. And again, the transition and discharge planning to make sure that they've got all the tools to be successful when they do return home. Another thing that separates these programs specifically is they do not provide clinical mental health treatment like therapy or counseling. However, a lot of these programs will help with the referral process. Not all individuals who come into this level of care require individual therapy or medication management. However, for the individuals that do, they will typically get those services on an outpatient level while they're still residing in this setting. There are also some group homes that will bring providers in, but again, it's not something that's provided by the group residential setting staff. Next slide, please. Next, we are going to move into the mental health residential treatment programs. These are our 24/7 living environments for children who have emotional and behavioral needs. These programs are supervised by mental health professionals, and they are designed to be trauma-informed and supportive. Children in this level receive therapeutic care, which includes individual, group, and family therapy, skills training to help manage emotions and their behaviors. One thing that sets these programs apart is their family engagement being a key standard. Programs are going to work closely with families and guardians to support healing, strengthen relationships, and prepare for that individual's return home. Sometimes there gets to be a little bit of confusion between mental health CRFs and QRTPs. I do want to point out that the qualified residential treatment programs that came from FFPSA do fall under the same category. So when someone is discussing a mental health facility, it could be that they're a QRTP facility that is included in there as well. Next slide, please. And then this last slide here, this is our psychiatric residential treatment facilities, which are referred to as PRTFs. These are an inpatient level of care that are provided in a residential facility instead of a hospital. These programs provide active treatment to children and youth who are under the age of 21 who have complex mental health conditions. The services that are delivered in these settings are under the direction of a physician 7 days a week to residents and their families, and include individual, family, and group therapy. These settings do require constant and consistent coordination with the child and youth and their families, as well as community-based service providers. And like you might have heard before, these programs prioritize discharge planning upon admission. And now I'm going to hand it over to Angela to continue.
Okay, so within some of our CRF mental health treatment settings, they can also offer assessment and evaluation. These are not a separate licensure, and they're not searchable on the licensing lookup. So I suggest that if you are looking for something like that, you would reach out to the facility and see if that is something that they offer, and what that looks like, because they do look a little different based on each program. The purpose of these was to assess and evaluate the child or the youth's strengths and needs, provide diagnoses, and recommendations for treatment and level of care recommendations. If the assessment and evaluation is being sought, the case managers must talk directly with the facility to determine what the service and program looks like I said, how they will be assessed and evaluated and for how long, and what types of information or assessments, recommendations will be provided at completion. So you just want to make sure you're communicating well with the facility to make sure that is going to meet your needs, and the child's needs. Next slide, please. The CRF locked settings. So there's also DHS licensed CRFs that can apply to offer a locked setting. These are different from the correctional secure and non-secure settings. So these are not the same as the correctionals. And for DHS licensed CRFs providing mental health treatment in a locked setting, it does need to be stated in their DA that this is a recommendation. The CRF treatment plan must identify and frequently evaluate how the child or youth can meet their goals to access increased freedom and movement. It also must plan for discharge from the locked setting to a less restrictive environment. These fall under the Rule 2960, 0.0700. Next slide. There are also CRF chemical dependency treatment facilities. They use the term chemical dependency rather than substance use disorder. Within these facilities, they must provide at least 15 hours of chemical dependency treatment services a week. And they must provide services that are specified in the individual treatment plan, developed with assistance from the child or youth's family and or guardian, support the child or youth in gaining skills necessary to return to the community, support the family in gaining the skills necessary to care for the child or youth to return to their care, and provided by qualified staff under the supervision of a licensed alcohol and drug counselor. Settings can be certified to both provide chemical dependency treatment and mental health treatment, so they frequently have dual diagnoses. All right, next slide, please. Discharge and transition planning. So each CRF setting must complete discharge and transition planning. And the type and amount of planning that happens is specific to whatever CRF setting the child has entered. So for example, the shelter discharge planning requirements are going to look different than the QRTP discharge planning requirements. So that's something to be aware of as you're placing a child or adolescent in one of the programs. The planning is to be done in collaboration with the facility, the child's guardian, and the lead agency. So collaboration and communication is a must, and it's very important to work through the discharge planning and transition planning to make sure it's going to work for everybody involved. And it's to support the safety for the child or youth post-placement. Case managers should be asking if there are recommendations or additional services. So does the facility recommend certain specific things that will be useful? And if needed, it's important to collaborate and explore alternative services to meet the child or youth's needs. For example, if you have a child who is in a very rural area, some of those recommendations may not necessarily be available. So you want to make sure that you're finding alternatives or becoming really creative in how to meet those needs that they are referencing in terms of the recommendations. All right, next slide. All right, and then back to you, I believe.
Yeah, thanks, Angela.
Yep.
All right, so we're going to do another LIL demonstration, or I'm going to do another LIL demonstration. And this time we're going to look exactly at those CRF services that Rachel and Angela just covered. So bear with me here as I stop sharing and move over to LIL again. As I do that, I just wanted to mention and hopefully clarify a couple of things from our last demonstration. So licensing information lookup, or LIL, it includes licensed providers that serve children and adults. And so if you're specifically looking for settings that serve children, it's going to be really imperative that you're clicking, as you're looking at LIL, that you're clicking into the actual licensed provider and looking at the age, the capacity, and the genders that they're serving. That's how you're going to know if they serve children or youth. There are some providers who might serve both children and adults, but for capacity reasons are only serving children at the time or only serving adults. So you're likely also going to have some of those conversations with the facilities. Additionally, for our children's residential facilities, some of them are very large, and as a result, they offer multiple units, and those units might all offer multiple services. So you could have a provider, a licensed CRF that has multiple units, and maybe only unit 1 offers shelter, and unit 2 is their residential treatment. And then another provider might do it differently. So again, after you've found maybe possible providers on licensing information lookup, again, it's going to be really imperative that you're calling the facility directly to discuss the child's needs and whether that provider has a service or a program that can meet the child's needs. So again, in order to look up the children's residential facilities, you're going to go to license type, click on children's residential facilities, and then you can see here those subcategories. These are all of the ones that we have covered thus far, except for the correctional services and the detention services, which we're not covering in this webinar today. And so if you were to click on mental health treatment and then search, it's going to bring up a list of all children's residential facilities that are licensed in Minnesota to provide mental health treatment. And as you can see, there are 12 active licenses. And so you can scroll down and see those. And again, you can turn that into an Excel spreadsheet. Going back again, I'll just click on another one here, shelter services. You can see that we have 25 licensed children's residential facilities that offer shelter. I'm going to click on one here. Itascan Treatment Center. Again, you can see that they have multiple units. They have a total capacity of 52. And then the units are broken down, how many children and youth they can serve, the name of the unit, the ages, and the gender, and then specifically what those services are provided. And so again, you know, it would be very important to be having those conversations with the facility to say, you know, I see on licensing information lookup that you offer shelter. You know, asking the provider may not have an open bed for shelter at the time, or having those conversations about, you know, this is what I'm looking for this child. This is what they need. This is what's in their best interest. You know, what do you have to offer? All right, I'm going to take us back here to the PowerPoint. All right, we are wrapping up here. So now we're going to talk a little bit high level about SSIS data entry, which is a child welfare requirement. And we're going to look at some best practices for the SSIS data entry. So when a child or youth is in foster care, there's certain pieces of information that must be entered into SSIS, and those include foster care and out-of-home placement information. And so one of the best practices is that when county or tribal agencies are creating biz orgs in SSIS, those biz orgs should be specific to the facility's address and license number. Sometimes we see biz orgs being created as sort of a general name, and let's say the name is Sunshine Facilities, but Sunshine Facilities might actually have 12 different licenses at 12 different addresses. And so some of the unintended consequences of using a biz org that has such a general name is that if the child goes from one of the licenses to another, there's not a way in SSIS to designate that that was actually a change, because it looks like because you have that sort of umbrella biz org, it's not providing some of that specific detailed information that's needed. Placement entries in SSIS are required for every move, including services or program moves within the same provider or facility. So for example, some of our qualified residential treatment programs provide non-QRTP certified services. And so if a child is receiving non-QRTP certified services and then moves into the QRTP certified services, that information needs to be entered into SSIS because it was a move. The child is moving services, even though they may not even be physically moving within the facility, but also because the QRTP requirements are required once they start to receive those QRTP services. And so then lastly, that best practice is going to be discussing with the facility the services and the programs the child or youth is receiving, again, to help you make that correct SSIS entry. So in the example of the move from a non-QRTP service or program to a QRTP service or program, that discussion is going to be necessary so that the worker and the lead agency is aware of that move, also agrees that that move is in the best interest of the child, and then can start those QRTP requirements. Here are some SSIS resources that are helpful. The first is a practice guide for entering child foster care placements in SSIS. And then in June, some of our foster care staff, along with SSIS, provided a SSIS coffee talk about placement entry in SSIS. And so these link to the recording and the slide deck there, as well as some updated guidance that came out of that. And then we've also included an SSIS research page that's located on the state's partner link, as well as an SSIS worker documentation site. And then lastly, we have some just general resources here. They're not specific to SSIS, but just a lot of the things that we've covered here today. So the licensing information lookup, or LIL link is first there. Then the second is the child foster care partner link to the training and webinar. And so this is where you're going to find this webinar recording and slide deck in the coming weeks, as well as your ability to access previous webinars that were given as part of a series that we titled Best Practices for Navigating Complex and Residential Placements. Foster care. Our foster care team also hosts quarterly community of practices, which are open to all case managers, so case managers from all the service areas, and it covers a wide range of topics related to case management for children and youth in foster care. And again, they are hosted virtually every quarter, with our next ones coming up next week, I believe. So this concludes our webinar. This is our general email addresses for the 3 kind of areas that were a part of this webinar: the Child Safety and Permanency Administration, where Ashley and I are from, then the Behavioral Health Residential Services team, where Rachel and Angela are from, and then our licensing division, the Mental Health, Substance Use Disorder, and Children's Residential Facilities unit, where our colleague Katie is from. All right, I'm going to stop sharing. And I think we are going to stop the recording and get into some questions.